Can you
Yes.
see it now?
Yes, of course. Yes.
Okay, sorry for the delay. So stigma is a strong feeling of disapproval that most people in the society have of something. And in this case, it's hepatitis, especially when this is not fair, it's unfair. So here we have a patient of hepatitis who is being stigmatized unfairly. And I decided to work on the question of stigma basically after two things. One, I realized this was an incident which happened in my hospital. A professor told his junior, you are infected with hepatitis B virus, you are a threat to patients. And that had a very bad effect on this young doctor. He consulted many people, then he came to me, I said, don't worry, your professor is ignorant, he needs to be educated. You don't worry. And I gave him all the literature which said that he's not a threat and he can practice medicine just like his professor. This was just an example of how people stigmatize without having a strong foundation, and even doctors do that, right? And this is the other thing which I often face when I send a patient for surgery or some procedure. You have the procedure postponement or avoidance, which we call. Sorry, you are infected with hepatitis B virus. I cannot operate on you now. And it gets postponed for no valid reason for quite some time, right? So there are two examples which we face in our day-to-day practice that made me do this study. We were looking at this study I am quoting. This is just, it's in press still, it's online, to drive home the amount of, stigma the poor patients with hepatitis B virus have to face. And what we found was that unemployment and illiteracy were the main predictors of stigmatization of these patients. There were different forms of stigma, which includes, the patient feels ashamed about having hepatitis B virus. These are very common. They feel that they're a trouble to their family in almost 85, 86%. 90% think they are putting others at risk for hepatitis B virus, and they should avoid close contact with others, avoid utensils. They feel they should be isolated, and that it may be viewed by others as a very shameful sexually transmitted disease. These are very common, instances of stigma which the patients suffer from. And they are viewed as undesirable as a husband or a wife. So there are so many forms of stigmatization which they have, and including, when they go for a healthcare, when they go to a doctor, there also they face stigmatization. And we found that there's a huge burden. And we concluded from our study that we need to educate the high-risk groups through well-designed preventive strategy, which may reduce the severe stigma and discrimination associated with HBV infection. In addition, in the case of hepatitis B virus, vaccinating the community against the virus can reduce the fear of infection and attenuate the enormity of the virus-related stigma and discrimination. In our study, these were the key factors, that is age, gender, education, and unemployment, which were associated with severe discrimination. So it's a major, and why, again, another reason why we did that study was that in one of our national meetings, leading hepatologists said, come on, hepatitis B virus, the patients, infected patients don't face any stigmatization in a country. I said no. And then we decided to do this study to place on record the problem which we face, right? From India, we come down from my department to Egypt. Now, this is a study done in Egypt, in Suez City, and this is on hepatitis C viral infected patients. And no wonder, at least one stigmatizing characteristic was found in 2/3 of patients with hepatitis C virus. 1/4 reported that he or she was not the same as others and they felt dirty about it. And 2/5 felt that they were bad people, Again, an equal number felt that people with hepatitis C are repulsive and are rejected, and they are hurt by the reaction of others. They stopped moving around with friends, and about 1/5, 1 out of 5 lost their friends. Then marital, most importantly, marital relationship was affected by the diagnosis of hepatitis in half of the participants in this study. And the authors concluded that patients with hepatitis C feel stigmatized in different areas. And there was a need for implementation of educational programs to raise the awareness of the community and healthcare providers about the stigma of hepatitis C and its negative consequences. There is a need for us means physician, healthcare providers, to act as advocates for the patients and not to perpetuate the stigma. Again, the same group of authors published this article in BMJ Open, chronic hepatitis B stigma in Ghana. No, these are different, these are different groups. This is Adjei et al. From Ghana, they had a study on chronic hepatitis B, and they found that this was a huge problem there. And they felt that given the prevalence of incorrect knowledge, which was very important, as reflected in the beliefs about hepatitis B, they recommended public awareness campaigns that emphasized hepatitis B transmission routes. This is very important. Next, given the manifestation of the stigma, they recommended implementation again of a continuing professional development program on hepatitis B and adjusted policy on hepatitis B vaccination for healthcare providers. The three main beliefs underlying stigma in Ghana were the belief that hepatitis B was highly contagious, it's a very severe disease, and it was caused by curses. And it manifested as avoidance and social isolation in general, but in the healthcare settings, as I mentioned earlier from my center, they manifested as excessive cautiousness, procedure postponement or avoidance, task shifting, and breaches of confidentiality. And again, in the article in BMC Public Health, this article was titled, "To Die is Better Than to Tell." Now, this is a major, that means it's a major problem. Anticipated, observed, and experienced stigma were important motivation for non-disclosure of chronic hepatitis B status. And if there is non-disclosure, it is we all know that this would not lead to proper management of the condition as far as patient is concerned, as far as transmission as a society is concerned, and therefore they recommended again development and implementation of theory and evidence-based stigma reduction interventions that are culturally appropriate and that prioritize the participation of target populations. They also recommended the provision of counseling and support services that assist these patients in the disclosure decision-making processes. So the key to control this is awareness and vaccination. And these are abysmally poor in most parts of the world. As this study was published not from any other small center, but from India's capital, that is Delhi, where this was done in 4 tertiary major hospitals of New Delhi. And they looked at the awareness regarding the problem of the transmission, the risk factors, and the vaccination status among healthcare workers. And it was shocking to learn that only 55% of healthcare workers was clean and had been vaccinated. 44% were not vaccination status conscious. And 28% had never been vaccinated. And this is the case from New Delhi. Forget about the smaller centers from different parts of the country. As this is a center from West Bengal, that is near Calcutta. And again, study conducted of 520 infected patients showed that the knowledge score was only 4.76 on an 8-point scale. Only 1/3 of the population were aware about hepatitis B and its vaccine, and less than 1/5 of the population were vaccinated with hepatitis B. Because in addition to vaccination, there is no awareness. How do you vaccinate? And this was again a study from our center on study and awareness about hepatitis B viral infection in coastal eastern India, where we studied 682 patients, and again we found a similar result, that awareness about the disease and vaccine was only present in 38% and 32% respectively. And 50% of those who were aware had no knowledge about route of transmission. They were poorly aware, and only about, again, 1/3 of the population were aware about vaccine, right? And vaccination was again in only 1/3, very similar to the previous study. Again, this is among medical students. There also vaccination rate was less than 50%. Although 2/3 of them had adequate knowledge about the hepatitis B vaccine. So, dear friends, awareness is the key. We need to create awareness about the modes of transmission. We need to create awareness about the prevention strategies. We need to create awareness about hepatitis B vaccine. And we need to create awareness as far as hepatitis C is concerned that it is a curable disease. It is a curable disease, unlike what used to happen when we, a couple of decades ago. So awareness is the key. Educational programs to raise awareness of the community and healthcare providers about the stigma of hepatitis B and C and the negative consequences is essential. We need to educate high-risk groups through well-designed preventive strategies which may reduce the severe stigma and discrimination. Vaccinating the community against the B virus can reduce the fear of infection and attenuate the enormity of hepatitis B virus-related stigma and discrimination. Thank you. Thank you for your patience. Thank you.
Professor